Hello and welcome to See What We See with Lorne Martin. My name is Lorne Cashin. I'm the Executive Director of the Ontario Opticians Association, and I'm here with my co-host, Martin LeBeau, Deputy Executive Director of the Ontario Opticians Association. See What We See is a podcast series dedicated to bringing you an optician's perspective on vision care and how it fits into your broader healthcare. On today's episode, we'll be discussing the relationship between nutrition and vision care. We'll be joined by Dr. Nisara Bandali. Our discussion today will include the common causes of vision loss in the elderly and also how food choices can help protect against some of these diseases. Martin, why don't you introduce our guest today?
Thanks, Lauren. Yes, hi everybody. I'm just so happy to have here as our guest speaker, Dr. Bandali. Hi, Dr. Bandali. How are you today?
Good, I'm good. It's great to be on here with you guys.
Well, thank you very much for joining us. I mean, we have a couple questions for you since you see a lot of patients every day. We wanted to discuss some of the eye disease that are out there. So maybe you can enlighten us with some of your knowledge here. Can you tell us a little bit about, maybe we can start with glaucoma?
Sure. So glaucoma is a variety of diseases that actually happen in the optic nerve. The optic nerve is a plug between the eye and the brain. So what happens is all these fibers slowly start to degenerate or die due to several reasons, most common reason being high pressures in the eye that kind of squish the optic nerve and cause blind spots.
That's great. Thanks, Dr. Bandali. Another thing that we tend to see more and more in offices today is age-related macular degeneration. I mean, what are some of the causes and why do we see more of those?
ARMD, or age-related macular degeneration, is actually so much more prominent now than it has ever been just because of our elderly population. And, all our baby boomers are now aging. So basically, it means they've had more exposure to things like sunlight, stress, certain types of medication. Just the retina itself is starting to get tired of replenishing and regenerating. So it ends up accumulating a lot of waste product in between the layers of the retina. When that happens, a lot of the times there's death or atrophy of the retina, and that can create certain types of blind spots. And mostly these blind spots happen centrally in the eye. And there's two types of ARMD. There's, of course, the wet and the dry. The dry is very slow moving. There's not really a cure for it or a treatment. And with the wet, it is a sudden onset of vision loss as there's blood that spurts into the retina from the layers underneath. And the retina needs some oxygen, some blood, and the eye creates that. And, there's a treatment. They use certain types of injections to decrease that blood flow, but it doesn't necessarily fix or treat the vision at 100%. It may, but it also may not. So.
Yeah, we keep hearing there's a lot more and more research on this to try to help people with AMD, which is unfortunate. At least there's some positive coming out of this with some treatments starting to appear more and more. Another one that seems to affect a lot of people, maybe everybody's cataracts.
Mm-hmm. So cataracts is when the crystalline lens or the clear lens inside the eye starts to cloud up. Now, people can be born with a cataract. It can be congenital. Another type of cataract can be traumatic. So when you get hit in the eye with something, because there's so much trauma that happens, the eye is trying to fix itself, and it's been shaken up, and so that can create a cataract as well. So that creates glare at night, blurry vision. It can create discomfort. You keep thinking you need a new prescription and a new pair of glasses. I'm sure you guys know that in your practices. People will come in and say, these glasses are not clear and these glasses are still blurry. There's something wrong with them. And, you try to fix it a million times, and you then call their optometrist or you check them yourselves and you see, oh my gosh, they have a cataract. Of course, it's not going to be clear, because you're looking through like a dirty windshield.
Oh yeah, we see that quite often, unfortunately, but we always find a way to help our patients anyhow, right? You mentioned that some cataracts actually can happen at birth. So speaking of glaucoma and AMD as well, did these diseases just affect like elderly or anybody?
These diseases are actually, they can affect anybody. Honestly speaking, they can affect anybody from age, however, it is more prominent in the elderly population because as we age, we've been exposed to more sunlight. As we get older, the cells start to slow down a little bit, and they've also been traumatized by, whether it is UV light or stress in general, any type of stress. Even your cortisol levels in your body, all this, it basically puts the elderly population more at risk because they've lived longer and their cells have gone through more regeneration, more trauma, more stress in general. So, but yes, it does occur even when you're young as well.
I've got a question for you.
Sure.
So a lot of people seem to think that all these diseases are hereditary. Would you say that on any of these few diseases, it's hereditary?
So, you know how they say nature versus nurture? I think it's a little bit of both. Of course, there are specific genes that you can get tested for where they mention, yes, you have a family history of macular degeneration, you have a family history of glaucoma. I know there's a specific gene for macular degeneration. And a lot of these patients, because their parents, their grandparents, their great grandparents had macular degeneration, they know that this specific gene can also cause that macular degeneration at an earlier age, rather than in your 80s, you might get it in your 60s. Genetics do play a role, yes, and that is also why, it's so important for patients to go see their eye care providers and ask questions. And, and I'm sure you guys, answer a ton of questions all the time. Your patients probably, worry about, if I have glaucoma, what if I have macular degeneration? And there's certain tests that can detect these things earlier. But of course, OHIP does not necessarily cover. Sometimes they don't cover for these tests, and there may be additional charges, but sometimes it's worth it, especially if you have a family history of these things.
Diabetic retinopathy. So I hear the word retina. I'm sure our listeners will hear that. So what is diabetic retinopathy? Why are we seeing more of that?
Okay, so again, this is like a series or variety of changes that happen in the eye. Okay, so patients who have like type 1 diabetes versus type 2 diabetes will be affected in different ways. A lot of it is to do with the blood being sludgy, so thickened by the sugars in the blood because of that lack of insulin, lack of oxygen as well, that it can create physical changes in the little cells in the retina. These cells, and maybe this is too technical, but I'm a little bit of a geek. These cells are called pericytes, and pericytes hug the little capillaries of the retina. And when these pericytes die off because of the lack of oxygen or the lack of nutrients, because there's not enough blood going into the retina starts to, it basically starts to break down. These pericytes cause capillaries to burst, so that creates little hemorrhages and microaneurysms and little pockets of blood. And then to make it even worse, it can cause damage of certain nerve fiber tissue. And so you get like little spots of like yellow and red in the eyes that, of course, people who do retinal exams can see. You can see them in pictures as well, which is pretty cool because the eye, of course, is, it's like a little tube where you can go into the back of the eye and see all these changes. To make it even worse, sometimes the eye, it's a cry for help, where we see when the sugars are reaching a certain level, we see that the eye creates its own blood line, I guess, blood stream. I would say it creates its own artery. And when it does that, that can start anywhere in the eye. And when it does happen, you start to lose your vision because it also creates little fibers in the areas where your retina should be clear. There's now a blockage there because it's a cry for help from the retina. So, of course, there is treatment for that. It may not necessarily 100% fix your vision, but it can help decrease a lot of the damage. Of course, going to your doctors and, having your sugars controlled and diet and exercise, all that is so important.
What are some of the risk factors of the other diseases like glaucoma, AMD, and cataracts?
overall health can play a big role. Things like metabolic diseases, like diabetes, can cause an increase in your cataract progression, just because your metabolism is constantly up and down, and it can basically pull water into the crystalline lens, which is just supposed to be purely crystal proteins, and then you get little cracks in these crystals because of that water being pulled in. People have thyroid disease, certain things called homocystinuria, Marfan's disease. Those are all genetic diseases. The cataracts can happen at a younger age. AMD, of course, a lot of research is moving toward like bad teeth can even cause AMD, exposure to sunlight, UV exposure. But now we're seeing more and more people are worried about their eye health because they're seeing all these elderly populations, suffering from these diseases, and they're getting more and more scared that, they don't want any of this vision loss that can prevent them from living their activities of daily life and their best life. Glaucoma is very interesting because there's so many different reasons that can cause glaucoma. And in certain types of people, let's say people who are hypertensive and take their medications at night, it can really cause a decrease of blood flow going up to the eye, and it can end up creating a little bit of that fibrous loss of the optic nerve, creating certain blind spots. I don't think doctors necessarily know what causes glaucoma, like in general. There's so many different reasons, but a lot of it is to do with your general overall health.
Wonderful. Well, thank you for joining us today. We really appreciate you answering our questions and giving some insights. Dr. Bandali, thank you so much. I want to tell you on behalf of myself and Martin and Ontario Opticians and our listeners, thank you so much. It was very insightful.
You're welcome. It was my pleasure.
Wow, what a great conversation that was this week. Such a pleasure to have Dr. Bandali on with us today on the podcast. That was awesome. Lorne, can you maybe let us know what we're looking at for our next podcast?
Sure, Martin. Our next one, we'll be talking about brain damage, vision loss in children. We'll talk about how mild traumatic brain injuries and how they become the greatest vision impairment for kids. So that should be really interesting. I'm looking forward to it.
That's great. Yeah, me too. This is something that definitely is going to hit home for a lot of people. Thank you, Lorne. We want to thank this week's sponsor, BrokerLink, great sponsor of the association. Thank you very much. We hope you enjoyed our Vision Month content as much as we enjoyed bringing it to you. We had fun. This was our first month of doing podcasts. We're looking forward to do some more. And on this, it's Lorne Cashin and myself, Martin Lebeau, saying thank you very much. And until next time on See What We See.
Thank you for listening to See What We See with Lorne and Martin. Be sure to follow us across our social media pages so you never miss an update or an episode. You can find us on Twitter at OOA_frontline. On Facebook and LinkedIn, we are Ontario Opticians Association. Follow us on Instagram at Ontario Opticians Association. That's all one word. We look forward to seeing you again on See What We See with Lorne and Martin. Take care and stay safe.